starting.
Okay, my name's Sally. I'm from Austin, and every major decision I've made in my adult life has hinged at least partially on my health insurance. My parents had talked about the importance of not losing my insurance. I remember being aware of it in high school. In college, I dealt with some depression bad enough that I dropped out. I was on my parents' insurance. They didn't want to cover adults who weren't students. There was a grace period. It was so hard. I managed to get back on before the grace period was over. When I graduated from college, I was lucky to get a job with insurance straight out of college. A lot of people don't get that. That's because I was willing to move to Florida. There was a gap there. I had to go get all my samples, be ready to start my new job, to get through that gap. A couple years later, I wanted to leave that job for political reasons. I even called my mom that morning and said, I'm going to do it. And she said, no, you can't because of your insurance. So I waited until I got my next job. I became very unhappy in that job. I got bullied. It took me years to use that word. And I stuck with it, a big part because of fear, because of would I get COBRA coverage. The depression got bad enough. I had to take some time off. I exhausted my 12 weeks under the Family Medical Leave Act, and I was out. That's when I moved back to Austin, and I fell into a call center job. I liked the people, but it was just kind of a job. Had my insurance. I had another bad episode. I had to take a few weeks off. That's when I met somebody who explained how she had wanted to start her own practice, but had to make it part-time because she couldn't get into the high-risk pool. I don't know if it was because of the money or if she wasn't eligible. And when I got over that episode, that is when I realized if this person couldn't follow her dreams because of her insurance, I mean, she was able to have a part-time practice. What did that mean for me? I knit and I crochet, and my goal has been to make that a career somewhere with a book, selling patterns, something like that. But I felt like I couldn't even really get started if I'd never be able to quit my job, if I would always going to be going for insurance. And that's what started making me feel really empty inside. That I felt like all I could see were just sort of endless jobs and no time for my dreams. So that was the biggest thing I wanted from President Obama. Everybody said, what was the hope and change? Obamacare was my hope and change. And I was laid off from that job. That's when they first passed the law. I started having a lot of pain, health problems related to that pain. I've been diagnosed with fibromyalgia. And it took me a long time to work my way up to working it again. I was living with my parents. I'm really lucky to have their support. That's when I went on the Texas high-risk pool, like the high-risk pools that are being talked about now. It was ridiculous. It was $486 a month for one person, $3,000 deductible, separate medication deductible, no pregnancy coverage, yet I was paying, I think it was about $130 more than a man for no pregnancy coverage. It was really hard, and I was lucky to have their help, but we saved so much money once Obamacare finally started. I was so happy in 2014. I said, no more excuses, I have to follow my dream. So now I teach knitting and crochet at a local craft store. It's not my whole living. But I'm doing that, some senior caretaking, and I'm juggling. I've got a courier job, and they all come together to make my money, to make my income. I still have a lot of help from my parents, but I'm happier. It's hard, but and I do have their help. They're paying my premiums right now, which are probably about half of what I was paying before. And I'm also have more coverage than before. But if I lost it, I've been really lucky to have their help. I don't know if that would mean I need to move home to help pay for that. I don't know. We haven't had a serious discussion about that yet. But I think people don't understand how limiting it is. If you haven't been sick, people think, well, if I just I could take my premiums and put in a savings account. It doesn't work like that. It's so expensive. And every other first world country has figured out we can't do it this way. I know I just don't want to lose it. I feel guilty that I haven't done enough to protect it.
You're here now.
Is that 2 minutes?
It's way over.